Greetings, everyone. So in this video, I'll try to brief you about the research scholarship and academic mentorship. Basically, I will talk on some of my research journey and also the research outputs and what I do really provide or support students when it comes to their research project. So in the first few slides, I'll focus on some of my research and scholarly achievements, and after that, I will also focus some of my research interest areas. Okay, so in the last couple of years, or in I can say for 2 decades, I've been in academia and I've done different types of research, engaged in from proposal writing to student supervision and also to publication and also attainment of grants, which I'll explain in the coming slides, and total number of quite interesting supervisions and quite a number of publications. So when I do supervise students, I really am interested on taking them to the end, either to encourage them to go for a conference presentation at the end of their research project, or else to publish their research finding, and also so that output will be a ground for knowledge, a ground for future research or future policy guidance and policy informations. That is very interesting. When it comes to the grants which I secured in the last, like I say, 10 years, could be a capacity building training program grant, which is from PTB, which is one of the huge grant, which is around in 2 rounds of $100,000. That is for vocational training for pharmaceutical production in USIU. The other huge grant, which I was a co-investigator and the co-writer, was the MasterCard Foundation e-learning initiative grant, where we managed to secure more than $5.9 million for USIU, which really supported an e-learning program where more than 15 different e-learning programs were developed and also approved by our regulators, and also a number of internal grants you could see for drug discovery research, for clinical outcome research, for example, in cancer, and also facilitation of a research conference that is with the Pharmaceutical Society of Kenya, where we got around $40,000 for the international conference held in 2024. So all this will try to tell you that a research journey, one of the things you do in research is also to write for a proposal, for your proposal to get approved and to get a grant. So that seed money or grant can help you to do a lot of research. That is one good thing. The other thing you could see is also a PhD supervision, and of the many few, one of these students recently who completed the research in the Doctor of Nursing, that is on working on a nurse-led education intervention on adherence to treatment regimen among patients undergoing hemodialysis in Avenue Hospital. This is one very good research where we obtained 3 high-level publications out of this work. An ongoing research project is also by Penina and Jail from JQuat, who are really doing more of a drug discovery related research, on one on antiviral, and the other one is on anti-cancer activity of these 2 croton species. So croton is one of my favorite plants. I've published quite a number of these on this plant. The other thing is postgraduate or MSc supervision, where in different areas of supervision on pharmacovigilance and pharmacoepidemiology, where we supervise students from the University of Nairobi, and also another student from Jimma University in Ethiopia who worked his master's pharmacology both on computational drug discovery, and also you can see other students, and also including a mental health research for which is by David, who is a clinical psychology student who completed his master's in clinical psychology, who really worked on enhancing mental health, help seeking behavior for men in correctional facilities. Okay, so quite a number of MSc thesis projects you can also see of students doing their virology, microbiology areas. And for sure, you could also see quite a number of undergraduate research papers. I can say near to 70 different undergraduate research projects, those doing pharmacy and those doing medicine, in nursing. And later on, I'll try to explain the different research areas of these students, okay, which ranges from drug discovery, community pharmacy, as you can see, hospital pharmacy. Some of the research focus on public health, on pharmacovigilance, okay, and also traditional medicine. Computational drug discovery modalities are also captured. Yes. And if we ask the question, why are you really conducting a research? When you see all that, you may be motivated to do a research, but you need to have the answer at the bottom of your head. What is the motivation? Okay. So as an undergraduate or as a student, be it from undergrad to PhD, your major motivation, the first one could be to earn a good grade, to complete your research, and to get your degree. Or the other motivation also could be to get a good grade, to secure scholarship. Okay, those are all good motivations. Okay, but on top of that, on top of these short-term goals, these are very important. You need to finish, you need to graduate, you need to get a good degree. But on top of that, you see, any of the research you do should be able to create a new knowledge. Okay, and your finding should translate and should help you to go to network, to present on international or local conferences. That should translate to a peer-reviewed publication. It should influence policies, and I'll show you some of the articles that are influencing policies, thoughts, perceptions, okay, that bring conversations and all that. So as you start your research, you should be aware the journey, okay? Always research starts from identifying a problem, or you may have a certain research question, and then you need really to dig out what will be the right method so that you can get a reputable result and also a publication. And again, the goal and the depths of research again depends and is different based on the different academic level you are in. Maybe for undergraduate students, maybe the goal is to learn, you see, the research process, to have a good writing skill, a citation skill, and also to come up with at least a publishable paper, so that after you graduate, you can engage with other researchers to be part of a research team. But in master's level, the goal of the research could be now to produce or to prepare you to be an independent researcher, okay, to come up with a strong methodology. While in PhD, the goal of the research is now you are expected to make an original contribution to knowledge, to innovate, and also to produce a number of publications. So as you do your research, especially undergraduate students should benchmark what has been done by previous master students. So part of their publications, part of their objectives could be your full research in undergraduate. The same master students should see what has happened by fellow master students in previous years or among PhD students. What have they done? Okay, is there any gap? Is there any recommendation they gave so that you can adopt that and you can try to expand on that to come up with your research area? And always the real question is students getting their research topic or research title, what area they work. And this advice I usually give: start with your area of interest. Okay, are you interested on antimicrobial resistance? Are you interested on drug discovery? Are you interested in the things that happen in hospital, in the community? Then from that you can come up with a specific researchable title. So that is how you should go, because if you have a good interest, if you have a good grounded knowledge, for example, in diabetes, then if you do a research with a title like factors associated with glycemic control among type 2 diabetes patients in Nairobi. It will be very easy because you can be able to explain science as you write your introduction, as you write your literature review. Okay, so it's so good to get the research from area of interest, or else you go and talk with a senior researcher, your university supervisor, professors, to recommend you on what research area you can work on. So I use both approaches in my research supervision journey, both with PhD, masters, and undergrad students. Okay. And once you identify your interest area, the next thing is also to read what has happened before. And there's always a term that I usually tell to students: what has been done before. This should be this should be your verse you should claim every day. When you are thinking to do data collection, when you are planning to do, maybe if you propose to do, no, I should do a lab work. Okay, I should use hexane to extract my plant material. First and foremost, try to assess what has happened before. Okay, what are the solvent used by previous researchers for this plant? If you need to calculate a sample size, maybe you are assessing treatment outcome among cancer patients in a certain hospital, okay, then you should first see a published paper on a related title, or else you should check thesis and dissertation papers. If you Google, maybe you can type University of Nairobi thesis repository, you can find. You could type Addis Ababa University thesis repository, Makerere University thesis repository. So all universities have a repository of thesis papers, especially masters and PhD, and that can give you the guidance, that can give you the idea what type of method do all those senior students use. Okay, did they use a questionnaire? What type of questionnaire did they use? You see, when you read a published paper, you may not get the whole information because published papers are usually a summaries of the whole research. So keep in mind, before you decide of your research title, the first thing you should do is ask the question, what has happened before? What has happened before? What a methodology can I use? What data analysis method can I use? You can answer that question by reviewing published papers or by reviewing theses or dissertations, which is very fundamental. And also in all that, you should think beyond graduation. You should think of, at least to finish your work, to go for either an oral or poster presentation of your research in a conference, and also to publish your finding. That is very, very crucial. In the next few minutes, I'll try to explain the different research areas and some of the ongoing projects which I do supervise students, and I'll try to explain them one by one. Okay, the first one of a research is the drug discovery research or natural product research is where one of my research area, and we have published quite a number. You can check under my websites on LinkedIn or else in Google Scholar, some anti-HIV activities, assessment of maybe phytochemicals from medicinal plants are some of the publications you could find when it comes to drug discovery. And even some of the ongoing PhD researchers, you could see that they are focusing on drug discovery studies, maybe anti-cancer activity of maybe certain medicinal plant extract or the different fractions or pure compounds of that. So this will really help such kind of research, not only for PhD, even undergraduate students, I'll show you shortly, have done quite a number of research when it comes to natural product drug discovery. Also, the other research you could see on top of what I mentioned earlier on this drug discovery research in the research we had on virology and infectious disease. Okay, so we've done quite a lot of research on anti-HIV activity, anti-herpes simplex virus, influenza, adenovirus, which is this research we are doing in collaboration with Kemery and also IPR, and that is quite an amazing, and you could see some of the publications, some of the new compounds isolated. Okay, in my research, always I say I'm proud to isolate near to 6 compounds, new compounds with anti-HIV activity, of which at least 4 of them are named after my name. So that is a doable research with whatever resource available, it can be done. But the issue is the drug discovery research from medicinal plants is a long journey. If you try to think of doing such a work, you should try to identify that, because of the global competition. If you do a crude extract, it may not be published because everyone from across the globe does such kind of research. And I'm also a reviewer, as I told you earlier, for quite a number of journals. You see, a crude extract, it doesn't tell you anything. So journal houses nowadays expect more intense research. You should do either fractionation, isolation of maybe few compounds. That's why my research was a bit rigorous, but I'm glad we collaborated with different institutions from local and also international in UK, with quite a number of labs, which I got support on, NMR and others. So for master's and PhD students, isolation and working on pure compounds is quite relevant. Okay, quite relevant, because that is what is expected at that level. And you can see some of the MSc projects from Eric now is completing with 2 potential manuscripts. This is from student from JQuat, where he tried to see anti-herpes virus activity of croton canadensis using both antiviral activity and also cytotoxicity. And also he used a bit of isolation using GCMS in collaboration with ECP, where he also tried to isolate compounds, run molecular docking, and some pharmacokinetic assessment. Okay, the same very amazing research by Rosell you can see on the same antiviral activity. My research also, I worked on neglected tropical disease, especially again from natural product, especially on anti-trypanosomal activity, and you can see some of the publications of some medicinal plants which are showing effectiveness against trypanosome. And also you can see other student projects maybe which are also published. For example, a very good research with Osman was anti-DLL activity of this plant. Okay, so which is an in vitro study and also basically an ex vivo study where we try to use an isolated intestine, part of the intestine, to see the anti-DLL activity of this plant. Antidepressant activity, we have neuropharmacology models in the lab, and that could be an excellent research which we worked with Tanzil 2023. Not only that, also students, if you see, they do a lot of experimental research on GIT pharmacology, on nervous system pharmacology. You could see the research with here Mustafa on skeletal muscle. This research currently on review in PLOS ONE, and you can see quite a number of them have also worked both in ex vivo, in vitro in the lab, and also using computational methods. You could see antimicrobial, antioxidant activity of plant extracts. You could also see cardiovascular research, which is an excellent research by Axena this last year. So in a summary, you could see quite a broad of the experimental drug discovery research, which is again supported by computational pharmacology, where I'm proud of this second paper published, and this quite heavily cited paper, which we did with Ghosh, which was published in Bioinformatics and Biology Journal on molecular docking validation. So for those of you interested to know more about computational pharmacology, this is like a textbook. And also on AlphaFold capacity building, on the role of artificial intelligence, on research on structural biology. We've done quite an amazing work with Dr. Emmanuel G. As a result, again, with all those motivations, recently I've established this fellowship program, which is an EMT CADA initiative, which is just an initiative to support young Africans on computational drug discovery and also drug design research, okay? And it was a 6-month fellowship program, which was completely free. We had trained more than 40 participants from different countries, and the first cohort has finished with good research projects, and we are currently working on their manuscript to produce some evidence, okay? The other research area on top of the first part, what you have heard up to now, is the drug discovery type of research. Also, I'm so interested in community pharmacy, pharmacovigilance, and pharmacy practice research, okay? So this research spans from assessing or documenting evidence on what is going on in community pharmacy, in patient counseling service, with regard to ADR reporting, ADR assessment, pharmacovigilance, on self-medication and pharmacy service quality. And with that, we have quite a number of published papers. This is an amazing paper we did with Seraphine in 2020. I think it's published in 2024. Very amazing, where we used simulated patients to assess pharmacists' role in patient education and counseling, okay, which really provided two of the students who did the related research with the skill to use this new method, which is using simulated patients to go and collect data from quite a number of pharmacies. The other one is also pharmacovigilance studied by Dr. Roda, which is on assessing use of complementary and alternative medicine among cancer patients, okay? And quite a number of students have really done a good report on that, which I can mention few, which have also done a related work. Also, Luis from University of Nairobi, who also completed his pharmacovigilance and pharmacoepidemiology masters, who did again antibiotic utilization study at Gertrude's Hospital, which was also an excellent research currently on review for publication. Not only that, currently, we have a student who just completed the research and the manuscript is submitted for review, which studied on knowledge, attitude, and practice and barriers towards ADR reporting among community pharmacies within Nairobi, which was an excellent research, and we hope to see this to be published very soon. So that is a community pharmacy bit, which really helps us a lot in documenting evidence. The other thing is also on hospital pharmacy, okay? Recently, I've got a very good student who really worked on assessing drug-drug interaction in hospital, which was a follow-up study by Dr. Brenda, who first tried to assess drug-drug interaction among admitted hospital patients during their hospital stay with cardiovascular disease. Then that was in 2023, and then now a follow-up study by Vicky, where again she did it in large sample size. And both papers, the first one, the Brenda one, is still on review, and hope Vicky is also finalizing her manuscript, so hope we'll see those publications. But these are very important because patients with chronic disease, while they are in hospital, while they are at home, they could have quite a number of multiple drugs, and drug-drug interaction could be one of the issue, okay? So when you see our hospital pharmacy research, it spans so broad, from drug utilization research, clinical outcome research, medication adherence, drug-drug interaction researches, okay, and also rational medicine use research are covered. For example, one of the research outcomes from my PhD student, if you see, adherence to hemodialysis is also a study we did in different three hospitals in Kenya. 2022, Dr. Patel did also an assessment of prescribing practice at TICA level 5, which was so amazing, okay, which was published in Pharmaceutical Journal of Kenya. Again, this year, Robbie did a follow-up study on assessing drug use pattern on the same hospital, that where she used the WHO, the indicators. What are the dispensing indicators? Is really good patient counseling service being given to patients that visit the hospital? What about the prescribing practice? Because as per WHO, recommendation, the number of drugs per prescription has a limit. The number of injectables per prescription has a limit. The number of antibiotics per prescription has a limit, okay? When those limits are not followed, then we see irrational prescribing that will predispose to antimicrobial resistance. You see, what about availability of essential guidelines? So she used all those indicators of the World Health Organization, which we call it as the WHO, and INROOT core indicators, and reported an amazing finding. We're expecting to see this publication in the next month. Has undergone 2 reviews in PLOS ONE international journal. That is quite amazing when it comes to hospital pharmacy, okay? I've told you about Kilonzo, which also did a hospital-based research, which completed his PhD. Again, Dr. Lois, who did also the same rated study on antibiotic utilization in a hospital pharmacy. So this could be a good area of research. Another research area is a public health research, where we studied about mental health with David, who just finished his clinical psychology, where we assessed the mental health of men, especially when it comes to the health-seeking behavior in correctional services. And this can be a study that could be expanded in different sectors. I'm also interested on such kind of research. On the same public health research, which I have not mentioned, is self-medications assessment, which we also did in few years ago with another student, which assessed self-medication status among or practice among university students. That's also another excellent public health research, okay? I've already mentioned about public health research earlier, the one we mentioned with in community pharmacy, and the other bit is pharmacogenomics, which was a good research which we did with KEFSA, with Samuel leading the team, and there's also another interesting review with regard to pharmacogenomics. And there's a lot of research to be done on pharmacogenomics, from experimental part, from the public side part, from the pharmacoeconomic part. A multi-sector research is again a gap, a potential area of research we need really to document in this one. The other research and supervision, which I'm also doing, is oncology and cancer research, okay? Part of it experimental in the lab, where we try to see anti-cancer activity of different medicinal plants. In the other one is outcome of cancer patient, treatment outcome of the cancer patient, supportive cancer cares. For the anti-cancer activity of medicinal plants, you can see the first publication that is made by my PhD student, Jane, who published assessing anti-cancer activity of croton megalocarpus extract. Another master's student from JQuat in collaboration with Kemery, which she published again effect of extracts of the Kenyan tea leaf against human cervical cancer cells. And again, with colleague Dr. Amsalo, we also published this paper in 2022, focusing on treatment outcomes of adult patients who visited Kenyatta Hospital with solid malignancy, which is a bit of a prospective cohort study, an amazing publication. So currently I have 2 master's students doing their oncology pharmacy at Kabarak University, basically looking at the treatment outcome, looking at the adherence of patients who are undergoing chemotherapy. Quite an interesting. The other interesting area of my research is also medical education research, because I say always, I'm not only pharmacologist, I'm expert in pharmacology, I'm also expert in curriculum design and development. I'm expert in medical education. So as part of this, I also do research, I also do advise different government agencies in terms of medical education, in terms of curriculum development, in terms of developing guidelines. And as all that service happens, also I document some evidence. And recently, I've submitted this manuscript with the title "Reflective Learning via Social Media," as it enhances professional identity formation and clinical reasoning in health professions education. This is the finding I got from one of the class I taught in last year. So maybe once it's published, then I can share more insight. But this is an amazing evidence. One methodology in university, especially in health professionals education, which we should follow to improve learning, especially as we are transitioning to competency-based training. That is a great insight. Not only that, on health policy and regulatory affairs is a very interesting area, as I mentioned earlier, from all the experiences we have. So recently we have finished a national baseline survey on good pharmacy practice in Kenya, where I'm the co-PI and the principal investigator was the Pharmacy and Poisons Board. We have finished the report. This is a huge report, which was a survey done across all 42 counties in the country, which is quite an amazing, and we're expecting quite a lot of evidence and publication from this work. And recently also I submitted this to Frontiers Journal in Health Service to give an evidence reflecting my view on health workforce specialization system. What is going on when it comes to specializations? Okay, so again, still on review, and when published, again, I can share more insight. The other research interest area is a traditional medicine and health policy. Okay, so because I do a lot of experimental research from herbal medicines. So again, it's very important to expand this research, doing ethnobotanical survey. What do the public on ground know about traditional medicine? What type of complementary medicine service do they have? So for that, this is my recent publication where I reviewed the African traditional medicine from history, how colonial disruption really affected this traditional medicine, and how or what we should do to ensure that its successful integration to modern healthcare. You can read it. It's quite an amazing publication published in Frontiers in Pharmacology. And we have done quite a lot of assessment and review. For example, if you see this one with Dr. Raphael from Kemri, where we reviewed again quite a number of medicinal plants with their antiviral effect. And we have also done ethnomedical survey with my students, that is Hena Lada, published again a few years ago, I think 2022. So where we assessed in Westland sub-county, what are the common medicinal plants used in that area. Again, with Bridget also, we reported it's an unpublished paper, but we did a good research in assessing some of the medicinal plants used in people's in Moala sub-county for skin disorders. And we've also done the same with another student in among the Maasai community. So traditional medicine, ethnobotanical, ethnomedicine survey is a big area of research. The other research interest area is the supply chain and global health research, where again, I'm an expert. I've been training people. I've been training health professionals in supply chain management in terms of selection, procurement, forecasting, all the logistics cycle. So I do also supervise few students. Well, one assessed on the procurement practice in Madare Hospital, the pharmaceutical procurement practice in that hospital. But again, potential students can work on that. Again, with regard to regulatory affairs, the grant we got from the dual vocational training grant we got from PTB is also another testament of the skill and the manpower development and the support which we can provide in these areas. And the short course training which I developed for Chemonics, MSH on drug supply management really puts me good to help young fellows in that research area. So in a nutshell, in the earlier slides, you have seen the different research areas. So if I am a supervisor, maybe for bachelor, master's, or PhD students, for current and for upcoming, this will be the interest research areas which you can come, we can have a talk, we can set your topics, and then we can work together. That is what I can say. On top of that, for all other students, maybe I'm not your supervisor, but I do also provide support through AGLS, where we do provide a research and publication support, which is a consultancy service from proposal development, data analysis, manuscript writing, and all that. And so the final message is, let us think beyond your graduation. Think about that your research could translate to solve a problem. Your research could be an innovative product that can translate to money, that you can think of entrepreneur to come up with a product, or you can think that this research can take you to a conference so that you make networks, connections. It can influence policies. It can get published, and also it would help to advance your career. So with that, I need to say thank you. If you have any question, you feel free to reach out at any point. I'm always available, and I need to say thank you at this point. Good.